Welcome back, beautiful tri-state area. You're listening to a moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2Lift in our Expert on the Microphone series. Today, we're featuring Dr. Stanley Okoro, founder of Georgia Plastic and Reconstructive Surgery. He's a double board-certified surgeon, also known as the Bowtie Plastic Surgeon. He's also quite the humanitarian, dedicated to advancing the field of plastic and reconstructive surgery, all while advocating for healthcare access and equity worldwide, particularly in underserved communities, providing life changing surgical care to individuals in need around the world. He's going to join me today to chat all about popular procedures for patients of color and how CO2 lift and carboxytherapy are at the heart of it all. Welcoming now to the show is the amazing Dr. Stanley Okoro. Welcome, superstar.
Thank you, Zen. Thank you very much for that wonderful introduction.
Reciting all of your accolades makes me feel like I'm in the presence of greatness. You've accomplished so much, my friend.
Thank you. Thank you very much. It's by the grace of God.
By the grace of God, always. Amen. Now, before we dive into the expert medical talk, I want to first chat about something I saw on your practice's website. It said a plastic surgeon should not apply a European quote unquote standard of beauty to every patient. Most patients prefer to maintain their ethnic identity, which
That
I
is
think is so important to note since for centuries, societal standards of beauty have favored European features, which have subsequently excluded and, more importantly, marginalized every other ethnicity. We have to point that out with differing features and force these groups to feel social pressure to change themselves despite their background. Now, in the US, the term ethnic plastic surgery typically refers to cosmetic plastic surgery in Black, Hispanic, and Asian people. Now, Dr. Okoro, when treating these patients in your practice, how do you navigate the balance between enhancing a patient's natural features and meeting the aesthetic goals they have, especially when popular beauty standards may differ?
our goal is to make them love the skin they're in. You know, it's about individualized care. As you say, we see a lot of African American patients, some Asians, some Hispanics. Our goal is to let me make you the better version of you. I don't want you to look European or anywhere else or any other standards in plastic surgery. This is about you, not about somebody else. There are some people that want to look like other people, but majority of our patients want to look like them, only better.
I couldn't agree more. And to piggyback off of what you're saying, backed by statistics, according to the American Society of Plastic Surgeons, more than 5 million cosmetic plastic surgery procedures were performed on ethnic patients in 2020, and 32% of all cosmetic plastic surgery patients were either Asian, Black, or Hispanic. Now, that's an increase of almost 2 million from the decade prior. So, as plastic surgery has risen in popularity and advancements, it only makes sense that many ethnic patients have become more aware of what procedures are best available to help them achieve their ideal beauty standards of what those standards are for themselves. So, Dr. Okoro, as an African American plastic surgeon yourself with many ethnic patients and patients with darker skin, what are some of the most popular cosmetic procedures you're seeing requested from these patients, and why do you think these procedures resonate with them?
So that's a very good statistic. And then those statistics are the ones that are actually reported. Many more are not reported. So it's more, I think recently the plastic surgery or the cosmetic industry have recognized that the African American patient, the Hispanic patient, the Asian patients there's a lot of them that want these procedures. So they want what everybody else want, but they have not been recognized or respected in the industry. So they want facial enhancement, they want breast lift. Many of my patients want the body, the curvy body, the abdomen snatched, waistline. And the good thing now, people still want a nice butt. They don't want a big butt. They just want a better looking figure. And the I guess the ethnic shape. Most Africans and Hispanics, they want that shape. So that's the most common thing that they request. But we always say, black don't crack. They always say that, but it
Yeah.
does after age 40. So the
Yeah.
facial needs come in play, but most young people want a body. As they get older, they want the face. So they want what everybody's want, but you just have to individualize it to their own needs.
Now let's bring CO2 lift into the picture. So carboxytherapy has been around since the 1930s, but the method of delivery has since changed and is no longer injected, but instead delivered non-invasively in a mask format, and it can actually be used anywhere on the body. In addition to CO2 lift being used as a monotherapy, it is also proven to heavily aid both pre and post procedure routines when using it in combo therapies. So, you perform many different types of procedures on the face, breasts, and body. How have you incorporated CO2 lift into your practice, and what benefits does it offer to your patients, particularly those with darker skin tones?
So let me kind of explain what CO2 lift is, because many people may not understand what that is. Okay. Essentially, what it does is it increases oxygen to your tissue, your skin. So it makes sense when you do any kind of procedure, you want it to heal, you want it to look better. So when you put the mask on, it forces your body to release oxygen into those tissues. That's like the topical hyperbaric oxygen to your skin. So I incorporate it onto all my facial procedure, facelift. This morning we're doing like micro needling of the face and neck. We're gonna put it after that. It calms the skin, makes it heal better. We incorporate it to any surgical procedures where I want increased oxygen. This morning we're also doing hair transplant. I'm gonna put it on the area where we remove the hair, so that area can heal really well. So CO2 lift is amazing. I put it on face, breast, and body.
Love that endorsement. Very authentic, very true, very well informed.
It's about
Are-
oxygen. It's
It's about
about
oxygen.
oxygen.
You
If you don't
can't,
have oxygen,
science is the science.
that science, I mean, is we breathe oxygen and we take it for granted. So if you have enough oxygen anyway, it's gonna look good and it's gonna heal good.
You said it. Now let's talk specifically about scarring and the post procedure routine. I know you're well known for your expertise in a long list of procedures, some of which include liposuction, breast augmentations, mommy makeovers, tummy tucks, and BBLs, what we just talked about. Now, again, looking specifically at patients with darker skin, these patients are more susceptible to keloids and hypertrophic scars and run a higher risk of facing abnormal scarring after a procedure. So, can you discuss any specific techniques that are particularly beneficial for treating this scarring? And I'd love to hear your thoughts on how CO2 lift can play into this as well.
The most important thing is how you handle the tissue. I've always said the skin of color skin cannot take a joke. If you traumatize it, it doesn't heal well. So we manage the scar from the time of the procedure. We handle the skin very carefully not to traumatize it. That's number one. If we're doing surgical procedure, we use special sutures that reduce tension so it doesn't heal bad or respond bad. Number three, post-operative management is the key. So we again, oxygen is everything. So once we handle the tissue well, we close it well with special sutures that will reduce tension. We put CO2 lift on it so you have enough oxygen to heal well. And then for those that still have scarring, I think the easy part is the surgery. The hard part is the post-op management, making sure that the patients are coming back to your clinic. And then if we have to inject it, we'll inject it with any kind of steroid or cream or injection to make sure we manage the scar well. That's how we do that.
And specifically speaking about CO2 lift again, are there any limitations or considerations you take into account when using it on patients with different skin types or tones?
No, the body loves oxygen.
There you go.
You can give enough oxygen. So I mean, I always encourage my patient at least do it at least 3 days. If you can afford to do it, the longer the better.
Now let's switch gears and talk about hair transplants again. I know you were actually the first medical practice in Georgia to offer Smart Graft, which is the latest and most advanced follicular unit extraction hair restoration system for
That's
both
right.
men and women. So you're clearly at the top of your game when it comes to this procedure. Now, millions of people of varying ethnicities suffer from hair loss and are great candidates for a hair transplant. But when it comes specifically at African American hair, in your expert opinion, how do hair transplant procedures for African American patients differ? And what do you suggest for post operative care to really ensure the best possible results?
That's a awesome question. So first of all, there's some significant differences in how we care about our hair. As you know, a lot of African American women, especially, they do braids, and the braids pull their hair out over time. So I don't recommend a long time braids. We call that traction alopecia around the front hairline. So a lot of them wear wigs and things like that, kind of not good for the hair. Okay, so they need, and then the African hair is coily. So we have to, the way we harvest the graft, we have to follow the curves of the hair so that we don't traumatize them when we put the hair back in. So this morning we're doing smart graft. Now, after we harvest the hair, we want the donor site area where we remove the hair from. We also want it to heal very well. So after that, we're going to put CO2Lift on it to increase oxygen so it will heal very well. When it heals, there will be no evidence that we were there. That's the whole idea. Like, we don't want anybody to know. We don't cut people. We harvest the hair individually. That's the follicular unit extraction you're talking about, because people
Yeah.
may not know the differences. So CO2Lift is actually plays a significant role in hair transplant, and then also for hair growth.
Incredible how many use cases this is applicable to, and more importantly, in combo therapies, like you said, pre and post procedure. CO2 lift truly is game changing. Now, you're also known for your humanitarian efforts, and we have about a minute left, and your advocacy work, specifically in the realm of healthcare unity, and have traveled around the globe to provide life changing medical care to the underserved. You even served as the president and executive director of Georgia Plastic Foundation, which is a nonprofit, charitable, and non governmental organization that provides free healthcare, scholarships, computer literacy, and youth and women empowerment to underprivileged individuals. Again, fascinating organization. And you're at the top of that. Very admirable pursuits. Can you share a particularly maybe memorable experience with us from your career regarding this work? And how can healthcare providers in your field advocate for more inclusive care to really ensure that these underserved groups are not left behind when it comes to medical care and advancements?
Yeah, that care is very dear and near to my heart. I like to give back. I think everyone should give back. You take from the society, you gotta give back to the society. It's a full circle of life. I love to help people. That's my passion. I do. As you said, we travel all around the world providing free surgical care. The Georgia Plastic Foundation is a foundation that we founded at Georgia Plastic. About 5 to 10% of our gross income goes to care, giving back to the society. We do all kinds of surgery. In terms of memory, there was a little kid that we did about 2 or 3 years ago, and he couldn't walk. He was burnt, and he had what we call scar contracture. His knee was contracted, and we're able to release his knee. Now he can walk. I mean, there's a little kid in Nigeria that had a big tumor on his head, and then they thought he was a monster. He was an outcast, couldn't go to school. And you should just see the smile on his face when the tumor was removed free of charge. And that's just giving back. When you help people, you feel good about yourself. I love helping people. I think plastic surgery has given me the avenue and the access to do what I love to do.
I just got chills. I just envisioned this little boy smile, and it brought a lot of
Priceless,
warmth
priceless.
to my heart. Yeah, that's amazing. Well, that was the end of an incredible interview. Thank you so much for being open, transparent, full of education and knowledge, and gracing us with all of this information, because knowledge is power.
Thank you very much for the opportunity to share my experience. Thank you.
That was our Going Deep segment, brought to you by CO2 Lift, and that was the incredible Dr. Stanley Okoro. Definitely head to georgiaplastic.com to check out his practice, and check him out on the gram at Georgia Plastic and at Dr. Okoro. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to CO2lift.com.